to next, that is the difference between suicidal wounds and the homicidal wounds. Situation in the suicidal wound will be left side of the neck and passing across the front of the throat, rarely on both sides. Homicidal wounds usually on both sides. So suicidal wounds will be left side of the neck and passing across the front of throat, rarely on both sides. Here homicide is usually on both sides. The level will be high above the thyroid cartilage. Because of the pressure, the rope or ligature will go up, but here the low, it will be low, ligature will be low or below the thyroid cartilage. Direction above downward and from left to right in right-handed person. Sometimes horizontal cuts across the front of neck are seen, which do not show variation in depth on either side. Here transfers or from below upwards. If attacked from right side of the victim, the wound runs from left to right. If from behind, it may resemble suicidal wound. Number of wounds. Multiple, maybe 20 or 30. Superficial, parallel and merged with the main wound, rarely single. In homicidal wound, multiple cross each other at a deep level, not repeated in depths of the main wound. Edges usually ragged due to overlapping of multiple superficial incisions. In homicidal, the sharp and clean cut beveling may be present, as seen. Okay, it will be present. Hesitation cuts will be present in suicidal wounds. No hesitation cuts, absent hesitation cuts in homicidal wounds. Tailing will be present in suicidal wounds. No tailing will be present. No tailing in homicidal wounds. Severity usually less severe. One wound may be extremely deep, extending up to the cervical vertebra, but sometimes 2 or 3 can be also there in the suicidal one. In the homicidal one, more severe, all the tissues including the vertebra may be cut. Wounds in other parts of the body, often present across wrist, groin, thighs, ankles or knees, and rarely on the back of the neck. So wounds in other parts are often present across wrist, groin, thighs, ankles or knees, and rarely on the back of neck. Here in homicidal, no wounds on wrist, etc., but severe injuries usually on the head and neck. Talking about defense wounds, this is absent. Unintentional cuts may be found on the fingers if a blade has been used. So such unintentional cuts are absent in homicidal. Talking about the hands, weapon may be firmly grasped due to cadaveric spasm. Here, fragments of clothing, hair, etc. may be grasped, and that will be of the person who did the homicide. Talking about the weapon, so we'll continue in next part. Total 16 points are there.